Dismiss no more, challenging medical gaslighting and advocating for Black women's health. How many of us have gone to the doctor before and felt like our medical complaints were disregarded, not taken seriously, and that made us feel some kind of way? If this has ever happened to you, you are in the right place. We're going to be talking about medical gaslighting and ways that we can advocate for ourselves as Black women. If you don't know me already, I'm Dr. Kamani. I'm a licensed clinical psychologist, also a toxic job survivor and a toxic job liberator for Black women. So I'm excited I have Black women medical doctors with us today. And so I will have each of them introduce themselves and we'll get right into the conversation. So I'll start with you, Dr. Luces-Sampson. If you could come off mute and introduce yourself, please.
Yes, hello, I am Toya Luces-Sampson, but that's formal. You can call me Dr. Toya, and I am an OBGYN by training. I'm from Trinidad and Tobago, and I'm also a women's health advocate. I'm a physician coach for physician moms who are postpartum and beyond, do lots of different things all surrounding women's health, and I am glad to be here. Thank you.
Thank you. Dr. Perez.
Yes, I'm better known as Lucy Perez. I am a pediatrician, an advocate for women, for Black people. I have been in the National Medical Association and was graced to serve as the 102nd president. This is an issue that we have journaled about, had in our journal for over 100 years. And so you know that is something that is, I mean, the issue has been picked up by the UN. So I am very excited about this conversation and what we can do to change.
Awesome. Thank you, Dr. Perez. Dr. Isom.
Yes, thank you. Glad to be here with you both. And also you, Dr. Kamani. I'm a psychiatrist practicing clinically in the Boston area. And I, in addition to that, do consulting around racial equity efforts for healthcare professionals, both at the organizational level and also at the individual level. And eager to talk about how medical gaslighting is connected to medical racism, which is a topic that, as you've pointed out, Dr. Perez, is a long-standing conversation and also one that's always worth having because Black patients are still dealing with the same dynamics. So excited to join and be a part of the conversation with you all.
Thank you. Thank you. I'm so excited to have these Black women medical doctors with us today. So I want us to start off talking about stress and chronic stress. So on my YouTube channel, I talk a lot about Black women in toxic jobs, and we know how stressful that is, particularly with chronic stress. So can we start off talking about ways that chronic stress manifests, in the presenting issues for Black women in terms of our physical health? So anyone can answer. So I just told the panel before that I present a question to the panel and whoever wants to answer can come off mute and answer.
Well, one area for me personally is chronic stress can lead to depression. And the depression is far more than the blues. And over and over and over again. And it can impact how we respond, our cognitive health. Because we know that stress leads to depression, which can then have an impact on how we think and our relationships. So it is something that we need to address. And the stress can also lead to anxiety, feeling anxious, and how that really decreases the enjoyment that we have limited time to experience. So I think it's very, very important that we look at our lives, we look at how stress is involved and how it can impact those things that reduce our enjoyment with life. And as I can see, living now almost 11 years longer than both my mother and father, it can decrease the years that we have to our
Yeah, our
it's
longevity, right?
our
Yeah.
longevity.
Yeah. So stress is important not only in terms of the mental health, right? But the longevity of our lives. So not only the quality of our lives, but the quantity of our lives as well.
Yes,
Thank you.
And our offspring.
Mm,
I know ABC, the Association of Black Cardiologists, it must be 20 years ago, did a study and found that less than 50% of Black high school graduates have 2 living grandparents.
wow.
And if you think of your grandparents, they think that you are. I know when I think of my grandfather, he thought I was the sun, the moon, and all the stars. When
Mhm.
you don't have a grandparent around, then so it's not only what it does to your own personal life, but also for your legacy.
True. True. Thank you, Dr. Perez. Dr. Luces-Sampson, I think you came off mute as well.
Yeah, so I wanted to talk about, on the day-to-day, especially when it comes to women's health,
Mhm.
the stress that we experience from this institutionalized racism can also just manifest itself as inflammation in the body, right?
Mhm.
We have that constant exposure to stress, raises our cortisol levels, and all of that inflammation is behind a lot of diseases. So
Mhm.
for my area, we think of something like fibroids.
Mhm.
We don't know the exact cause, but we
Mhm.
do know these things are all tied to this chronic inflammation, and that can definitely be linked to the chronic stress and the weathering that we experience when you live in this country under the weight of institutionalized racism.
Yes, yes, yes. Can you all speak a little bit about weathering? So, in the previous conversation that Dr. Isom was a part of, we talked about stress and the impact on Black women's experiences. Maybe, Dr. Isom, can you talk a little bit more about weathering?
Yeah, I appreciate the comments from Dr. Perez and Dr. Luces-Sampson because it's communicating the totality, like the bigger picture of how this can affect Black women specifically and Black people in general in ways that are both related to them as individuals and also to their relationships, their family, and other types of relationships that they have. One way to think about weathering is if you think about a tree that's, constantly being beat in the wind, to a certain extent, that tree has been created over time to be able to withstand that. So you can push as hard as possible. Some trees fall over, but for the most part, they've been created in such a way that they can withstand that.
Mhm.
Humans have never been expected to, across evolution, withstand chronic stress. We were created to have these periodic short bursts of stress that would create these reactions in our bodies and our minds. And then the stressor leaves and we go back to normal, our normal status quo. Chronic stress does not work well for us. And when we're exposed to chronic stress, whether as children and adolescents or adults, our body responds for a bit and then it becomes different. And the difference could be in how it handles stress in the future. So after all of this weathering of things like institutional racism and its impact across a number of different settings, such as school, employment, trying to get a loan for a house, all those different areas kind of chip away at you. And then your response to stress in the future is different than what it should be. So you might have an exaggerated or a more intense or extreme response to minor triggers because your system's been stressed so much over time. And then in addition to that, being in a stressed state makes you more vulnerable to things like the development of, after chronic stress, of things like depression and anxiety, but also the development of ways of your body operating that creates a vulnerability to even infections. So we know that one of the things to reduce your likelihood of getting different kinds of infections is stress management. And some people can do a list of checkbox things and reduce their stress, whereas others are positioned in such a way in the world that stress is unavoidable. And that's when stress becomes chronic and one could argue toxic. So weathering is one way of describing toxic stress that is persistent exceeds the body and brain's ability to overcome it. And then you have all these consequences that come after.
Yeah. So I have two follow-up questions to what you all just said, okay? So if we think about the chronic stress, toxic conditions that, as Black women, we are confronted with racism, sexism in every system that we're in. So if we are in a system, let's say a toxic job, and it's this persisting chronic condition of degradation, right? What are some ways, number one, what are some ways that Black women can deal with that stress, right? Because my understanding from the previous conversation was that when we remove the stressor, that sometimes that can help reverse the condition that you might have. But if you are continuing to stay in a stressful situation, that will continue to wear you down. So for Black women who are in this chronic stress, toxic work environments, what are some of the things that they can do when they're in these chronic conditions? Anyone?
I'll say really quickly that we would hope that we could adjust our exposure, which means leave or like work different days or have different people around us. Like one would hope that's an option. When it's not an option, it's often about how you take care of your nervous system and your body just in general after the exposure and before the next exposure. And that's when this conversation around self-care becomes not one of privilege or like convenience or just like a nicety, but actually one of survival. So how after these exposures, how before, during, and after these exposures, do you take care of your body specifically as it relates to its stress response? And that can include things that we often make out to be these warm and fuzzy things, but very much our survival strategy. So it might be breath work, for example, in the form of yoga. It might be just being in silence for like an hour, depending on what your home situation is like. It might mean going to a top of a nice place outside and screaming into the wind to release and discharge some of that energy. It might be exercise, body movement in general, but it really has to be something intentional about the recognition that your body is having a stress response, and then some ways of addressing that go beyond some of the fluffy stuff that we talk about, such as like going to the nail salon. That might be a part of it.
Right.
We need a little bit more.
Yeah. So the important part is discharging that toxicity out of our system. And if we don't, then that impacts our survival, right? I love how you said that it's a matter of survival. It's not just the fluffy stuff, it's survival, right? So what about the rest of you in terms of what can Black women do, especially in these toxic work environments, because so many Black women are in toxic work environments?
Yeah, I just want to talk about that from a perspective that may not come to top of mind, but is one that I utilize for myself, is social media. And the necessity for some people like me to just not be on there, because you have these stresses that you cannot avoid. Right, you have to go to work. You may have to deal with, your environment in your neighborhood or your partner. You don't have to be on social media, and it may be a very enticing thing to, relieve stress. The scrolling sometimes can feel like it's therapeutic. But when you take in all of that negativity, because a lot of it is negativity, when you take in the comparison to other people, especially for my clients and patients, that mom guilt that you see, and if you are really invested in things like releasing yourself from toxic stress at work and the state of affairs of African Americans and Black people in the country, your feed kind of looks like mine, right? There's a lot of advocacy and a lot of trauma. Like it's like trauma porn, and you're interested and you want to be educated and up to date, but that has an effect on you. And it's like, when do you get a break? Because we just need to be okay with taking a break and taking a rest. Like Dr. Isom said, you can just for a minute remove yourself from that level of stress and just be.
Yes, just be. Yes. What about you, Dr. Perez?
Prayer. Just taking and making it something that is not the warm and fuzzy things that we also do. Nail salon, getting your hair done, getting a massage. For Black women, that's not an extra.
Mm-hmm.
That's as important as shopping for food. It
Wow.
has got, there has to be something on the list specifically for you.
Yeah. Yeah.
Specifically for you. It's not an extra. In
Mm-hmm.
order to do what we do, this has got to be uh, uh, an essential component.
Yeah.
I said prayer and being a part of something where you have to show up.
Mm-hmm.
You have to show up in church. And sometimes I have to pull it together to get so I am able to go there. There's
Mm-hmm.
an accountability when
Mm-hmm.
we are a member of a faith community to show up. And
Mm-hmm.
in doing that, I think it helps address it.
Yeah.
And
Yeah. So
it's one,
community, yeah. So being a part of the community, spirituality, engaging in behaviors to discharge that toxicity out of our system, being mindful of what we're ingesting with social media and just media in general, because that messes with our psyche, right? So Dr. Isom, you also said something that prompted another question too. You said that when we're under chronic stress, that can cause like an exacerbated response. So that made me think about as Black women, we're very mindful of not fulfilling the Black woman angry stereotype, right? So how does that look in the workplace if things are happening, this chronic stress, people are playing in your face and disrespecting you, you're dealing with this ongoing, right? And it makes you get to a point where you want to go off, but you recognize you cannot do that because then you are fulfilling the stereotype of the angry Black woman. What are we to do in these situations?
Listen, I just had a meeting last Thursday during which it was racially stressful. There was some gender stress too. I mean, essentially like the intersection of being a Black woman in a leadership role in charge of a project that is considered to be political. So like a social justice and health equity curriculum role in an institution that's been around since, the founding of this country, really, I won't name, and has lots of cultural aspects that are toxic and anti-Black. And in preparation for this meeting, I knew it was going to be really difficult. And then when I got there, I definitely had a re-traumatization experience of, gaslighting, invalidation, dismissiveness that pissed me off.
Mm-hmm.
So here I am in this meeting. I'm pissed.
Mm-hmm.
And it's interesting because my pissed in this setting is still pretty muted. So I had a surge of, stress in my body and my mind. I felt emotional. And what I had to do to not fulfill the stereotype was speak assertively and with passion and name what was happening. That was my approach.
Mm-hmm.
So for example, naming dynamics in the room that were happening, such as white supremacy culture, naming out loud that I was feeling emotionally dysregulated because of a lack of transparency in the conversation. So connecting my emotional experience to something that would be normal as a trigger, which is you're not keeping it real. That would irritate most people, like stop wasting your time sort of thing. And while I felt that my response was measured and professional, even the expression of emotion and all the expression of like the agitation I was feeling felt like it would be pathologized because of that stereotype. So we toe the line, and between the risk of speaking up and the risk of not speaking up, and at the same time, I think a part of humanizing ourselves does require us to name what's happening for us, and when we feel that we can do so safely.
Yeah.
And then also, I think swallowing everything has consequences. That means that, in some instances, a part of how we're treating ourselves or healing is just by verbalizing or speaking out about what's happening when everybody else is denying it.
Right. So you're conscious of how you're being perceived. You're trying to articulate things in a certain way, but at a certain level, you're swallowing some things. Now, the hope is that you're able to kind of say what's happening in the moment, but sometimes you're not safe to do so. So then this is swallowing. And so that swallowing, what impact does that have on Black women? I know I've swallowed quite a bit in toxic jobs. What impact does that have on Black women in terms of our physical health? I know in terms of psychological, but what about physical health?
Yeah, I think it all ties back into that chronic stress, right?
Mhm.
It is just one more thing. And I'm getting a little triggered just having this conversation about all the things that, I've had to swallow, being consistently misunderstood. And, you say one thing, you think you sound one way. Well, you sound one way. And then the reaction is just like, you sworn I was pointing a gun at somebody. It's just like, so it's all a level of stress that we kind of internalize, and then it gets transferred into that chronic inflammatory state that then leads to XYZ down the line.
Yeah.
So it's a tough place to be, and that intersection is a very interesting one. I don't know that there is a perfect answer, but it can definitely affect us.
Yeah. And I'm so glad you talked about fibroids in terms of inflammation, because so many of us have had or do have fibroids. So tying in that connection with the chronic stress and the inflammation. And, as a therapist, I would absolutely say to Black women, when we are ingesting and swallowing and all these different chronic stress experiences, the hope is that you do have a therapist, that you're able to talk and process this, because it's crazy making. And the longer you have it in your system, the more it can start messing with your mind. You start self-gaslighting yourself. It's just not healthy. So my hope, Black women, as you're watching this, that you are in therapy if this is your experience. Dr. Perez, you were going to say something as well?
I was going to say music. When I'm in a situation, like there are some songs, Luther, Can I Take You Out? When I am feeling minimized, I think of Luther just singing to me. And I can do it now in the midst of a horrible meeting and everybody's coming down on me. I can just go there.
Yes.
And I have that song, and what makes you feel powerful, and have those songs and that music that takes you someplace else when you're in a situation that's toxic for you.
Yeah.
You have to get rid of it.
Yes.
Even if I can't do it at that specific time, at some later time, do it.
Yes.
If you have a partner, go home and say, I need a foot massage.
Yes. Yes.
I need something.
Yes.
I might need that thing, that we're all thinking about. Take care of me.
Yes.
Take care of me.
Yes.
We have to get rid of that poison.
Yes. Because if we don't get rid of it, the poison poisons our body, right? And I love that you said music, because we know that music is a cultural form of healing as well, right? So I want to shift the conversation a little bit. So can we talk a little bit in terms of how traditionally, historically, the medical field has discounted the medical concerns of Black women? What does that look like? Or what has that looked like?
I'll start. I'll start and just take us back to like the plantation. So Black folks in this country, relationship with medical professionals has always been around their usefulness as labor, as an object for which labor is to be provided. And in their relationship with healthcare professionals, it's either been we're going to get you back out there, to perform that labor role, or we're going to make use of your bodies, for experimentation and advances in science and all that good stuff. And at the same time, the racist beliefs about whether or not Black people can accurately describe what's going on or how much a Black person might be misrepresenting their symptoms goes back to the plantation as well. There was a tendency to suspect that there was this thing called malingering happening, where there was an exaggeration of symptoms or a misrepresentation of those symptoms to avoid, for example, going back to, the field or wherever they were placed at the time. And even for folks who were not at the time enslaved, there was still this suspicion or skepticism present. We've done nothing really to address that. So it's woven its way over the centuries into just how we operate as healthcare professionals, inclusive of how we are all socialized, including myself, throughout our medical training, to believe less, to be more skeptical of, more suspicious of, more questioning of how Black people interact with us, what they say is going on, what they don't reveal is going on, and to also have a suspicion at a level that disregards context. So whereas there might be like a very valid explanation for why something's happening connected to where a person lives or the kind of work that they do, we're more likely to, because of how we're trained, to believe there's something that they're doing or not doing that is producing their symptoms. So you're not taking your inhaler, this 14-year-old boy, and that is why you are having asthma. Not that you live in an environment that's toxic environmentally, that is increasing your symptom burden related to asthma, and that's explaining, blah, 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 blah. So here we are now, socialized to be these, well-intentioned healthcare professionals that just go out there and do the good, work, and really in denial about the ways that these racist stereotypes, assumptions, prejudices, biases, whatever you want to call them, get in between us and our patients and lead us to disbelieving pain, disbelieving symptoms, or like dismissing or invalidating them, and a repetition of the same kind of relationship that has existed since these, enslaved Africans and free Black people were interacting with majority white healthcare professionals. So it really is the same old, chapter, book repeating itself. And we haven't done what we've supposed to do as healthcare professionals and institutions to be responsive to that history.
Yeah. So the individualized blaming, right? There must be something you did. And I look at the contextual things like environmental racism. And then the part you said that I wrote down too, we're going to get you back out there. I hear that so much from Black women who say they go to the doctor because they're stressed out about the job. And the doctor said, I can take you off for a few days, but what can we do to hurry up and get you back to the job, right? So discounting of this job is making me sick, right? So what about Dr. Luces-Sampson and Dr. Perez? What are some of the ways that you've seen or know historically ways that the medical profession has discounted the medical complaints of Black women?
So, like Dr. Isom mentioned, the one that is the most prevalent for OBGYN is the discounting of pain, especially when you think about laboring, right? When you come in and you're having pain, will you be sent home? Will you be believed? Or if there is some sort of complaint and it is dismissed as something that is minor when you actually have something life-threatening, like an appendicitis or things like that. There's so many different areas where it can happen, and it really is just woven in. When I think back to how I was trained and the things that I believed, they were all, many of them, based on racist stereotypes and tropes. And those have to be actively unlearned so that we can take care of our patients in the way that they deserve.
Right. The stereotypes. Yes. Thank you. What about you, Dr. Perez?
The same, stereotypes again. Early in my career, I know for me, it was the extent of the pain that Black people can absorb more pain. So therefore, let's not give them pain medication, or the fear that there will be an addiction associated with the use of pain medication. Almost to the point that I have seen many of my friends and family members say, oh no, despite how painful we know their condition must be,
Mhm.
They don't want to touch it. They don't want to fall into a stereotype of being
Mm.
someone who is using more pain medication than
Even
necessary,
if they need it,
even if they need it.
and if they're suffering, right?
They're suffering. They're suffering because they don't want to look like
Yeah.
the stereotype that's been placed out there.
Wow. Wow.
And that's difficult. And that physical pain as well as an emotional pain.
Absolutely.
Why not address the fact that I've got this condition that now has also impacted how I relate to my family? So I have emotional pain
Yeah.
associated with this.
Mhm.
One of a close friend recently transitioned, and that was after her cancer had exacerbated.
Mhm.
And I could not believe that she hadn't been offered therapy.
Wow.
Why wasn't therapy suggested for her and her family?
Mm.
Knowing that we have gone from a case of remission now to stage 4, and
Mm.
knowing that in a very short period of time, her whole life, her whole family's life would change.
Yes. Yes.
That
Dr.
wasn't the comprehensive kind of care that I think she deserved.
Absolutely. And Dr. Perez,
And
you were saying that that really I felt that when you were talking, I felt that, and I felt what an injustice, right? And just not valuing her humanity, her family's humanity. It was just like, okay, oh well, let's just move on. And I think many times as Black people that we perceive that other people are perceiving us, that we are not human, right? That we can withstand more pain, that our emotional doesn't matter, our families don't matter. So I'm wondering, when you think about all these different issues, how does that then impact how many Black women then start perceiving the medical field and doctors? How does that then impact us?
Yeah, so for OBGYN specifically, I've seen this in recent years, and it is troubling to say the least. It
Mhm.
has gotten to the point where I have heard women say, I will never set foot in a hospital again.
Wow.
These are pregnant
Wow.
people saying that they will never set foot in a hospital again. And
Wow.
when you imagine you have the institutional racism that increases your risk for all of these diseases, making your pregnancies higher risk at baseline, not
Mhm.
because of race, but because of racism. And at the same time, you're saying, I will never set foot into a hospital. It is a scary thought. I
Absolutely.
understand it, but
Yeah.
it breaks my heart that we have swung so far with this pendulum now that my people don't even trust me, because there's only so much comfort you can get from seeing another Black face when you
Mhm.
have the weight of all of these years of mistreatment and mistrust. It is heartbreaking.
It is. It's terrifying, right? That you think about how many of us are not seeking medical treatment because of how we've been treated. And so part of it is like, I want to protect myself, but then you're putting yourself at more risk in ways too. Oh, that's so sad. What about you, Dr. Isom?
Yeah, I think it's interesting because there's this image of physicians and patients. It's definitely propaganda to a certain extent, but also is real for some, where the doctor, swoops in, does a house visit, pats you on the shoulder, caringly looks at you and offers you a treatment plan. And your posture in that kind of interaction is one of deference. I am going to listen to what the doctor tells me to do, but also a feeling of warmth. Like, this doctor is cares about me and is going to take care of me.
Mhm.
We are stigmatized people. And studies have shown the more stigma associated with you, the less warmth you've received from others, and also the more incompetent you are perceived to be. So people don't trust that you know what you're talking about, or that you can offer, for example, a good history. So you end up with these really cold, distrusting interactions with healthcare professionals, which then creates for you a defensive and offensive posture. You're not just sliding into the room, waiting to see the lovely old, physician who's going to take care of you. You're offensively preparing to be, discriminated against potentially in that interaction. And then you're defensively responding to things that happen that are aggressions towards you, such as you offering, a piece of history and it being dismissed or discounted, or interactions or behaviors from that healthcare professional suggesting that you're not as intelligent or capable. So you're defending yourself against those. You're preparing yourself for discrimination when you're supposed to be focused on what are my symptoms, like what is happening to me, and accurately reporting that. So you end up having less of a successful, for some of us, depending on how we're positioned, how we feel that day, who we're working with, but less of a successful interaction that's filled with fear, anticipation, anxiety, stress, whatever. And that's not pleasant. And that's why so many people wait until the last moment, the last minute to seek out healthcare in general, because healthcare can be aversive and not fulfilling, but specifically related to this type of posture of having to be on the defense and the offense while trying to get help when you're the most vulnerable. It makes sense that people are like, I'll just wait till the last minute. Maybe I won't go ever, or I'll wait until I'm actually on death's door and I'll go to the emergency room. And then the emergency room is what the emergency room is. No shade, but it's not the place where you get lots of warmth usually and the best perceptions about you, because it's a high stress, under-resourced environment. So you end up getting really low quality healthcare experiences across the board, unless you're lucky, based on your geography, where you are, or your class, which can help improve things. So, for myself, I do get some of those privileges based on class and being a physician. And at the same time, subject to those lower quality healthcare experiences too.
So the offensive defensive, right? And I think that, because I hear a lot that, Black people, sometimes we wait to go to the emergency room, but that it makes sense, right? So we're not getting a lot of access and the ways that we're treated by the health industry, right? Dr. Perez, did you have any additional thoughts about this as well?
Last year at the convention, at the NMA convention, a lot of my work was around HIV disease. And there was a patient who was part of not a patient, there was a woman who was part of the panel. And she shared that the offensive, defensive kind of posture, she apologized, because most of the audience, of course, were physicians, and she apologized for her anger. She saw, when she interacted with a Black physician, she connected there. But she said, your life, she resented that my life was some way better than her life. And so she was angry at her disease and her situation, but resented me because she thought that me in my position was better. And so there was a resentment. So asking questions about history, she was angry. She was angry. She assumed that I had a nanny, that I might have been driven to work, that I had money to do this, and I had access to other things that was different from her situation. Despite how familiar I wanted our interaction, the physician-patient interaction, to be. And that was an aha moment for me. An aha moment in such a way that I have been blessed to have had a generation before me that were physicians. back in the day where there were house calls. I know we're doing more of them now, but where the physician was more of the community. At the same place, hug, just a different type of interaction, so that there wasn't such a disparate life connection. And I think that that's very, very important.
Yeah.
I was just part of All Healers. We're having a colloquium at the National Medical Association. And one of the things that we want to do is get community groups in there. Yes, touch, feel. We are the same.
Yeah.
We
Yeah.
are the same. We are striving for the same thing. It's so in that, I think it's very, very important. My daughter is a hand surgeon, and many of the obstacles here in specialty work, many of the obstacles is just not appreciating how much we are alike.
Yeah. Yeah.
And that limitations in providing comprehensive services for our patients isn't our decision. They're decisions that are made by insurance companies, health plans, that we have nothing. We can't do anything about it. Administrative things, like how many people are booked for a service, what the waiting room looks like. It's not the physician, even though we are in that position. So many other issues are associated with that. So that's a point that I think requires a level of education for our community
Agreed.
to appreciate, because
Agreed.
they have changed.
Absolutely.
Medicine isn't practiced the same way it used to be.
Yeah. And I just want to speak to several things you said, Dr. Perez. So one is the importance of Black physicians to be aware of other issues that may be coming in place, impacting the dynamic, right? So internalized classism and how that might be projected and how to break through those barriers. Also, you talked about All Healers, mental health, right? So Dr. Perez and I are part of All Healers. Dr. Anel Prem heads this up, and this is disaster relief for Black communities around the world. So I want to give a special shout out to All Healers and Dr. Anel Prem. But, that part is so important that on one regard, we might have a sense of commonality, but class issues, and because of how we live, might cause some divisions as well. So how do we come together as a community and still uplift one another, right? So I want to put a pin in that because we're going to come back to that question, that issue, right? So doctors, can you share? So if Black women are having these experiences, what are some ways that we can advocate for ourselves? What are some tips or strategies that you can offer to Black women as we are out, interfacing with the medical field?
I'll say briefly, there's a, so the point I'll make is this: we're perceived as less competent. That's the reality of it. That's where we sit, which means healthcare professionals are less likely to believe that we can accurately report our symptoms, accurately understand what's going on, that they are less likely to believe that we can even participate fully in informed consent and decision-making. Wow. So how much information do I give you or not give you is influenced by all these stereotypes and assumptions. One way of helping us to appear more competent is in the form of preparing for the visit. This is what I tell my people. Okay. You don't need to show up to the visit without a script. So you need to have a clear sense of what you are coming to this appointment for, in collaboration with whoever you have in your network, of course. A clear sense of the questions that you want to ask, a clear sense maybe even of the phrase that you might use when you're being talked over. Like really preparing yourself for what that interaction will be like and the ways that you will dance with that healthcare professional in that space, recognizing that you might be in a 15-minute visit with your primary care doctor versus a 30-minute visit with a specialist. Like, how do you take all that into consideration?
Mhm.
That's where the education part comes in.
Mhm.
And then there's also technology. There's a colleague, I believe, I'm going to go find her name. I think it's Kirsten Monk, who has this application specifically for this purpose of supporting folks and engaging in healthcare who are racially minoritized, where you do that pre-work before your visit in the app. You're recording your symptoms, what's going on with you, and then you have the app with you during the visit. When you're facing all that stereotype threat, all the distractions, the stress, the fear, anxiety, you have that data right there that you can use to have that conversation with your physician or healthcare professional. And there might be other components to this app that are available now, such as ways to support you in like getting the follow-up stuff done that you've been recommended to do, blah, blah, blah. But I make that point to say that there are things we can do. And then I think technology can fill in some of those gaps in supporting us in showing up, appearing competent, as much as we can, and then maybe navigating some of the stuff that shows up in the visit that would prevent us from getting our needs addressed.
I like that. I like that. So having a list of what are the questions that you want to ask, the script, being prepared for if you are being talked over, what is the phrases that you can use when that happens, and also technology. And Dr. Isom, if you can find that information, if you can send that to me, and I'll put that in the description section as well. What about for you, Dr. Luces-Sampson? What are some ways that Black women can advocate for ourselves in these medical situations?
Yeah, I was actually going to talk about preparation, but for me, again, my context is obstetrics and gynecology as well. But when you think about even before you get to the doctor, choosing the right person that is going to listen to you, is going to see you as human, right? A lot of people don't have a choice, and I recognize that. So it's one of those things where you like, oh, just find somebody else. Well, it may not be that easy. But if you do have these choices, then what are the things that you're going to look for, right? If you are pregnant and you're coming in, there are certain stereotypes in the way that obstetricians operate that are rooted in the very real way that we were taught to practice back in the day. Like there is a change that's happening. It's happening slowly, but it's happening. So you will see those kind of practices in somebody who tends to lean older. This is not like an ageism thing, but more how you were trained, right? There's a way that we dealt with pregnancy as this disease state and all of that. That is a very old way of thinking and training. So how was this person trained? When did they train? Are they, going to be aligned with what I imagine for my birth and for my care in general, and asking around, because that kind of reference and the word of a trusted colleague, friend, or whatever is often going to be better than like a Google review where who knows what's on there. But really getting like, who is this person I'm going to see? Do my friends have good experiences with them? Do they feel like they're heard and seen and believed? Just preparing in that way as much as you can. And then the last thing I would say, and again, this context of somebody who is at the intersection of a lot of things, has experienced a lot of the toxic stress and all of that. I tell everyone every time, like the first time, right? Because we talked about it before, and Dr. Isom spoke about it beautifully. When you've been traumatized so much in the past, your response to this new interaction may be heightened. You're on the defensive, you're on the offensive. When you come in to see a new person, you're bringing all of that with you, but there's still this human interaction. And if you are coming in guns blazing, you may not get the best out of that interaction. That may only be 15 minutes, right? So every time, like the first time, if it is this new person that you're interacting with, and giving everybody the benefit of the doubt, but being very ready to come at them if you need to with all of the information and everything, right? So we're not saying to be docile, but just starting that off to get the most out of that interaction that you can.
Yeah. So be open, right? Because recognize it's a new doctor. Hopefully, you've already gotten referrals. People said it's a good doctor. Be open, however, be prepared. So if it goes left, then you know how to advocate for yourself. Okay. Thank you. What about for you, Dr. Perez? What are some ways that Black women can advocate for themselves or ourselves?
Bring somebody with you. Have a buddy. It's so important because as in many situations, I know I don't always hear what's really being said. And having somebody with you. I know it's very difficult. We all live very busy lives and things like that, but have a buddy. Somebody who may feel very differently about a visit than you do.
Yeah.
Just because of what they have. And for us, there are three Black female physicians, four of us here now. We also need time. And I thank you for this space to discuss this. That we need to talk about it.
Absolutely.
We don't have many of those outlets that we used to have where we were able to have these kind of discussions. I know most of us, our dining room table is more for sorting than it is for sitting down and communicating and doing those kinds of things for our generation and future generations.
Yeah. Yeah.
Because we have a legacy.
Yeah. Yeah.
So it is very important, I think, for us to have a buddy, somebody who
Agreed.
goes along with us to
Agreed.
many of these visits.
Agreed. And I just want to share with the audience and with the panel, the reason why I'm having these conversations is that, I'm becoming aware, just as many people are becoming aware of how many Black women that we're losing in very high profile jobs. And just thinking about the stress that they may have encountered. We also know about the loss of Dr. Antoinette Bonnie Candia Bailey in terms of the workplace bullying and all of that. And we know about research is talking about that Black women are now dying at earlier ages because we're developing cardiovascular disease earlier because of all these external issues. So when I see things like that, and when I was at the previous toxic job, there are a lot of Black women who are not that much older than me dying. They were dying or they were developing cancer, having heart attacks, strokes. So this is very serious, right? So even though I really talk about Black women in toxic jobs, this is a relation to it, right? So chronic stress can impact our health. So I'm thankful that I have Black women medical doctors here to have these conversations. So as we're winding down, ladies, I'm curious about something because some other research that I saw was that Black people who have Black medical doctors typically have better medical outcomes. Can you all share your thoughts about that, about why that might be?
I know I see my family, in my, in my training, that was one of the criticisms, that I got too involved with my patients. I often compensated for some of my colleagues who I thought were curt and disrespectful. And so I took care of my patients and their patients because of that. Not feeling that I had the opportunity to call them out the way they should have been called out, but making sure that my patients were taken care of the way they should have been taken care of.
Yes.
So, and that added more stress to my life. So we can't here. We want to take care, but then we're also now doing somebody else's job.
Right. Right.
And they
So
can
it's
say
showing
no.
compassion and humanity, right? Extra work for you, but you're looking at the patient and centering the patient.
Right.
Yes, yes.
And the National Medical Association did a study. It's old, 15, 20 years old. But we found that, but the science is that Black doctors will follow up with their patients.
Mm.
I know I had my cardiologist, Lucy, where are you? Get in here. You need an echocardiogram. I mean, they will call me. They will, they will follow up. You need this, you need that. You know, we're good.
Follow-up. The
We're
follow-up.
good. And as quiet as it's kept to get in, the whole way. To get a B, we were doing A work. We're definitely going uphill,
Yeah.
not downhill. So in terms of competency, and we're better.
Just to spread out, right? Yes.
We're better.
Better, and that the love of compassion and the sense that we are family. So even though not all Black people are the same, right? Even like if you're from a different country, but you come here, we're not all the same, but we have common histories. And I think that helps us in terms of that love of compassion and humanizing our experiences. What about for you, Dr. Luces-Sampson?
Yeah, I feel like, you spoke to something that's true for me because I am not American. And, there's my favorite part of interacting with Black people is finding the commonality because there's so much commonality between us from our ancestry. Like
Yeah.
I can realize that we have the same food that, is in the South as we do in Trinidad and in Nigeria. So we are all connected. And
Yes.
I do want to speak to something that is probably in somebody's mind who is listening to this. I had a Black doctor that treated me bad. So are we saying that all Black doctors are the best? Of course not. But if you look at statistics, if you want to take your best chances, finding somebody that sees themselves in you, can see your humanity because it is their own, you are setting yourself up for a better experience. And like Dr. Perez said, we had to go through so much to get here. We tend to be better just because.
just saying, right? Thank you. What about you, Dr. Isom?
Yeah, I mean, if you look at a rose that was properly fertilized and a rose that grew up through concrete, I would have questions for that rose that grew through, concrete. Like, how did you get through that? And what benefits does it offer to you, as well as cost? I think if we thought about this as an overwhelmingly white healthcare workforce, working with white patients are offering them humanizing experiences. Not consistently, not all the time. There's other factors, but let's just say they're offering more humanizing experiences because of their ability to identify and connect with their whiteness. It's a whole nother part to this that's just about how the healthcare system itself has been geographically located in ways and organized in ways that do support the health of white people in our country more. But just that human connection, I think all that is coming from us in our relationship with Black patients is related to that humanizing, as well as the rose through concrete stuff as well. And I also think we're skillful, not just with our own people, we're skillful with, everybody, because we have to interact with people across a number of differences. We're not perfect. We still have, struggles, but I can connect with and humanize a white patient just as successfully as I can a Black patient. And that does not hold the same truth for a white healthcare professional who specifically has not been asked to or sought out intimate relationships with others who are not white. There's a clumsiness there, an awkwardness there, a lack of understanding and connection there that creates those less, humanizing and overall less quality experiences. So we are built different because we've had to navigate life differently. And that does produce some benefits in our ability to connect with not just Black patients, but patients across the board. So I think a new study, and it's new, So there's still some understanding there, but it really was just having a Black physician in a particular area, a geographic area, produce health benefits to the entire population in that area,
Wow.
not just Black patients.
Wow.
That is a paper I've seen, and I think there's more stories to be told from that and more understanding from that. I really do think, well, I believe it's important to highlight that we are skillful in connecting not just with Black patients, but with a broad spectrum or diversity of patients, because we've had to.
Yeah,
we've had to
absolutely. Absolutely. Okay, I have another question. I'm sorry. So what happens if a Black person, a Black woman, is not able to find a Black doctor? Let's say they're not in the area. Let's say their insurance doesn't have a Black doctor. What are some things that the Black woman could look at or evaluate in terms of a doctor who's not Black?
Yeah, so just some of the things that I'd mentioned before, you can't beat word of mouth and getting actual facts from people who have seen the doctors. And I just want to touch a little bit more on my mistrust of Google reviews, because I think that's a lot, what you hear a lot is that check Google. And we see now with social media and, I don't want to use the term cancel culture because I think that's nonsense. I think people are getting repercussions for their actual actions. But, there's this culture of, well, if I don't like something you say or do, I'm going to go and destroy your life. Right. So that is true for physicians as well. Right. So you may not necessarily get the truth there. But if you have family members, if you have friends that have all seen this doctor and can co-sign and say, I was treated with respect and, I felt heard and seen and well taken care of, then that is someone that in lieu of a Black physician that you can feel more comfortable seeing. So it is just a matter of being willing to do the work beforehand, and then also having the courage to say, if I have this interaction, I'm not going to go back, right? I'm going to continue to look around again, if you have the ability to do so, because it's not always that easy.
Yes. Thank you for sharing that. So as we're winding down, for real, as we're winding down, can you all please share about services that you offer and how Black women can contact you?
Should I go first again? Okay.
Sure.
So I do not have a traditional OBGYN practice because I know that's usually the first question that I get. I work in hospitals only, and but I am a physician coach. I coach professional moms who are postpartum and beyond, and just really trying to take away from the badge of honor that is struggle of postpartum and early motherhood, right? It was so funny when I heard Dr. Isom speaking, because it's so much of what I focus on is that this period does not have to be a struggle. Like, it can be easy. It can be made easier by asking for help, by doing all these things and having someone to guide you along the way. So that is where I'm focused now, because of my own postpartum experience with a different story for a different time. And so I can be found on I can be found on my website, drtoyacoaching.com. So that's DRTOYA coaching.com. And you can follow me on social media, because I also believe that, like, asking postpartum women to advocate for themselves and to stand up for themselves and change their reality is one thing, but it's also like asking Black people to end racism. So it is important for people who are around these women to educate themselves and to take up the cause of changing this experience that everyone who has a child has to go through. Like, it's a very universal thing. So I encourage family members, friends, anybody who is not of childbearing age or ability to engage with me and my content, because you need to know too. Like, we need to take care of the people around us, just like we need allies, true allies, to help, right? To help with racism in this way. So let me get off my soapbox, but that's where you can find me.
Yes. Well, I appreciate all that you share, and I'll be reaching out to you to come back again, okay, to talk a little bit more about a lot that you shared. What about you, Dr. Perez? What services do you offer and how can people contact you?
Primarily, I have been working through the church, the AME church, and by word of mouth as a healthcare advocate, friends who and friends of friends who need support in that way. You can reach me through, I guess, my email address. The AME Church, I'm at Kingdom Fellowship, AME, which is in Maryland, and the National Medical Association. And we represent, over 70,000 Black physicians in this country. And we have chapters outside of this country as well, in the Caribbean and in West Africa. So anything that we can do, and we're very, very interested because of certain postures associated to entities that are over 100 years, to be an umbrella for other nonprofit entities that are looking to address racism in medicine. So either at the AME Church or the National Medical Association, you can find me.
Awesome. Dr. Perez, can you just speak a little bit more about All Healers, please?
Oh, All Healers. All Healers started when we saw the catastrophe of Katrina. Mm-hmm. And how our people were treated. Mm-hmm. And there came together just about all of our national Black organizations to address the immediate needs. And Dr. Annelle Prim, second generation physician, I might say. In fact, her father was a mentor of mine in substance abuse and HIV disease. She has, since Katrina, has been convening a group providing critical assistance, specifically mental health assistance all over the world. I can't say just the United States, bringing equity, her connections with FEMA, holding their feet to the fire to make sure that there's equity with resources. And that is an organization that we have to pray for her, because what she does is monumental.
She's remarkable. She is remarkable.
She is remarkable.
Yes. And I will put information about All Healers in the description section as well. So thank you, Dr. Perez. What about for you, Dr. Isom?
I love Dr. Prim. She's amazing.
Yes, she is.
I've been a fan of her since I was a medical student, and then now I know her more personally. She's lovely. I'll say one thing to shout out. The Joint Commission is this organization that supports, gives institutions that offer healthcare services permission to function. So a lot of places that you go to have to answer to the Joint Commission, and they have this campaign called Speak Up. And the Speak Up campaign is a few different topics, but one topic is specifically about discrimination and knowing your rights. So I put that link in there for you, Dr. Kamani.
Okay.
They have videos, they have info guides that tell you exactly what to do as far as knowing your rights in the institution and also outside of it. So like civil rights connected to healthcare experiences. I'll say for myself, as well as where people can find me, I am practicing at an under-resourced health center. So you can only be my patient there if you are a patient of that health center. And in addition to that, I can be found on social media and things like that. I do have a company that does racial equity consulting, and we are exhausted. So as far as where people can find me for additional work, to be determined. And for me, that's connected to the fact that I want to live as long as possible.
Yes.
renegotiating what my
Can I just affirm you? I just wanted to high five you for saying that. Okay, that Black women, we deserve rest, and we do so much for so many people, but it has to be a certain point we have boundaries, right? So I
Right.
appreciate you saying that. Yes.
So I'm in the stage of sort of I have active work, and there's also a hibernation mode to figure out what would allow me to live as long in a quality life as possible. And then once that's clarified, I'll say you can find me in that sense. However, on social media, I do talk about medical racism and offer just some educational stuff, and I'd like to offer more advocacy stuff. So if folks do follow me there, there'll be some content around that coming down the line. So thank you.
Awesome. So I'll put all of their information description section. The chat has been very lively. I'm not going to read all the comments. There were 2 questions that I wanted to ask the panel, though. I think it was 2 questions. One was, how can we handle micro and macro aggressions in the workplace and remain professional? That was the first question.
Yeah, there's a lot of answers. I think for that, I can send some materials. There's lots of places that can give you a script as far as what to say in the moment. There's just a lot of stuff out there. So too much to list, but happy to send some stuff. Dr. Kamani, to you.
Awesome.
And knowing that you're not alone, knowing that, their sisters getting hit like this left and right.
Yeah.
And being appropriately armed to address it and expect it.
Expect it. And I would also add that, the micro and macro aggressions, that's going to happen, right? But recognize at what point it's costing you in terms of your physical, your psychological well-being. If it gets to the point where it is harming you physically and or psychologically, start thinking about, is this the place that I want to stay? Now, again, the micro, macro, they're going to be there. But if it's so pervasive that it's harming you, then really think about, pause and think about, is this the place for me? And start thinking about your options, right? Okay.
Just one last thing.
Yes.
Therapy.
Absolutely. I completely co-sign with that, Dr. Perez. Okay, I think the last question is, after I found a brain tumor in November 2023 with emergency surgery, benign, thank God, I now believe all Black women should have CT scans because of our undue trauma. It just didn't feel right. Your thoughts?
Again, I can't disagree with it. Some of the limitations are, how do you get it? How can you afford it? Access. Goes back to what I learned about sickle cell. If you can't do anything about it, it's important that we prepare the way.
Yeah.
So it's, it's not in isolation.
Got it. Okay. So everyone, I know that we went a little over. I want to say again, thank you to my panelists. I'm so thankful to have 3 Black women medical doctors. Awesome. I love this. And so audience, please watch this as many times as you need to. The ask is that you also share this video with at least 2 other Black women. If you have not already subscribed to my channel, please do so. Lifting Us with Climb Consulting, Wellness Services. Just a brief announcement that Marissa Price and I are hosting the Job Liberation Virtual Summit for Black women, which is May 18th and 19th. So this is for Black women, no matter where you're on the continuum of, I'm starting not to like this job, to this job is driving me crazy, to I got to get out of here, okay? So it's going to provide you with information about how to walk through the fear, but also the how-to, the practical, how to replace your income, what to do about your health insurance, your life insurance, all your different options. Click the link that will put you on the waiting list for early registration. So again, that's May 18th and 19th. We have Stephanie Perry, Alicia Renese, Anne-Marie Archer, the anti-HR lady. So click the link, okay? So panelists, I want to say again, thank you so much. I'm so thankful to each of you. And audience, thank you so much for tuning in. Again, please share this video with at least 2 other Black women. Give this video a thumbs up and subscribe to my channel. And everyone, I will see you later. Panelists, if you could just stay on for one moment. Bye, everyone.